There is a pill in your medicine cabinet right now, maybe 2, maybe 3, and every morning you take it faithfully, because your doctor prescribed it, because you trust it, because you believe it is protecting you. What nobody told you is that several of the most commonly prescribed medications in America have a documented, well-researched side effect that most patients never hear about in the exam room. They quietly and systematically damage the part of your brain responsible for memory and clear thinking, and the people most at risk are adults over 60. My name is Dr. Mae Jemison. I am a clinical neurologist, and I have spent more than 26 years specializing in cognitive decline and memory loss in adults over 50. I have sat across from hundreds of families who could not understand why their loved one's mind had begun to slip, sharp one year, foggy the next. And almost always when we reviewed the medication list, the answer was right there. Stay with me. What I am about to share is what I tell my patients in the office, information most people never get the chance to hear before damage has already begun. Before we go through the 7 medications, I want to explain something about how the brain changes after 60. Think of it like the plumbing in an older house. In a new house, if one pipe narrows slightly, the water pressure barely changes. The system compensates, but in a house that has stood for 60 years, those pipes are already narrower. If you introduce something that constricts them further, the rooms farthest from the main line lose pressure first. In the brain, those rooms are the areas responsible for memory and word retrieval. After 60, your brain's reserve of a neurotransmitter called acetylcholine central to memory and learning is naturally lower than it was at 40. The brain is already working with less margin, and certain medications shrink that margin even further. This is documented science from the American Academy of Neurology and the National Institutes of Health, not rare complications. Effects your prescribing physician may simply not have had time to explain. The first medication most people would never suspect is the one they reach for most casually. Antihistamines, specifically diphenhydramine, the active ingredient in Benadryl and in most over-the-counter sleep aids. Most of my patients have been taking it for years. It is over-the-counter, so how dangerous could it be? Here is what is actually happening inside your brain. Diphenhydramine belongs to a class called anticholinergic drugs. It blocks acetylcholine, that memory chemical. Think of acetylcholine like the electrical signal running through your brain's memory circuit. Diphenhydramine wraps insulation around those wires because that is how it causes sedation. But it does not just quiet the allergy signal, it quiets the memory circuit too. A landmark study in JAMA Internal Medicine tracked adults over 65 for 7 years and found that regular anticholinergic medication use was significantly associated with higher dementia risk, with higher doses linked to even greater risk. The pill millions of Americans take to sleep may be quietly borrowing from their memory with interest that compounds every year. Tonight, look at your sleep aid. Read the active ingredients. If you see diphenhydramine, ask your doctor about non-anticholinergic alternatives. Your pharmacist can help identify them. Safer options exist, but you have to know to ask. I want to pause and ask you something directly. Have you noticed your memory becoming less reliable in the past year or two? Words that used to come easily now sit just out of reach. You walk into a room and forget why you came. If any of that sounds familiar, go to the comments right now and write yes, just that word. Because what comes next may explain something that has been confusing you for longer than you know. The second medication surprises people even more. Bladder control drugs, oxybutynin, tolterodine, solifenacin, are widely prescribed for overactive bladder in adults over 60. What most people are never told is that these drugs cross the blood-brain barrier. They get inside the brain, and once inside, they block acetylcholine in the same way diphenhydramine does. A comprehensive analysis in the journal Neurology found that older adults on anticholinergic bladder medications scored measurably lower on cognitive tests. Not theoretical, measured. Do not stop any prescription without your doctor's guidance, but do ask whether a non-anticholinergic alternative exists. Mirabegron works through a different mechanism without the same cognitive risk. Write that name down. The third category is one I know will be harder to hear. Benzodiazepines, Xanax, Valium, Ativan, Klonopin. Prescribed for anxiety, for sleep, sometimes for years after the original reason has passed. Most patients tell me they feel calmer on it, more like themselves. What I have to explain gently is that the calm they feel is not clarity, it is suppression. These medications enhance GABA, a chemical that quiets brain activity. Think of GABA like a dimmer switch on a light. Turning it down feels like relief, but when that dimmer stays down for years, the brain adapts to that suppressed state as its new normal. Research cited by the National Institutes of Health associates long-term benzodiazepine use with a 51% increased risk of Alzheimer's disease in older adults. The consequence of that number is a family sitting in front of me asking why their loved one has changed. Not knowing a prescription written years ago may have been slowly altering that person's brain. If you have been on a benzodiazepine for more than a few months and you are over 60, ask your doctor, is there a tapering plan? I want to tell you about a patient I will call Margaret. 67 years old, retired librarian from Ohio, one of the sharpest people I had ever met. Her daughter brought her in because Margaret had been misplacing things, losing track of conversations, repeating herself in ways that frightened the whole family. When I reviewed her medications, I found 3 things: a sleep aid with diphenhydramine, an anticholinergic bladder drug she had been on for 4 years, and a low-dose benzodiazepine prescribed after she lost her husband. 3 anticholinergic influences running simultaneously every day for years. We worked with her primary care physician to carefully transition her to alternatives. 6 months later, Margaret called my office. She said, "Dr. Jemison, I feel like someone turned the lights back on." Her cognitive scores improved measurably. Not dramatically, some of that time cannot be recovered, but enough for her to feel like herself again. Margaret's story is not rare. The common thread is always the same. Nobody connected the medications to the memory loss. You are making that connection right now. If you have a family member over 60 who has been on any of these medications, save this video and share it with them when we are done. This is information they deserve to have before their next appointment. We are only at number 3. What comes next surprised even my most experienced patients. The 4th category involves something many people in this audience take every single day for heartburn: proton pump inhibitors, omeprazole, pantoprazole, lansoprazole, sold as Prilosec, Prevacid, and Nexium. Long-term use has been linked to reduced absorption of vitamin B12 and magnesium, 2 nutrients the brain depends on for memory consolidation. Think of B12 like the oil in a car engine. The engine does not stop the moment the oil runs low. It keeps running, but the wear accelerates quietly, month after month. Research in JAMA Neurology found that regular PPI use was associated with a 44% increased risk of dementia. If you have been on a PPI for more than a year, ask your doctor at your next visit to check your B12 and magnesium levels, request those 2 specific labs, and ask whether the current dose is still necessary for your situation. The 5th medication may surprise you. Certain blood pressure medications, specifically beta blockers like metoprolol, atenolol, and propranolol, have been associated with memory fog and cognitive side effects in some older adults. The American Heart Association has noted that lipophilic beta blockers, the type that penetrate brain tissue, can affect cognition in older patients at higher doses. Beta blockers are life-saving for many people with heart disease. Stopping them without supervision is genuinely dangerous. The point is not to stop them. The point is a specific conversation with your cardiologist. Ask whether yours is lipophilic or hydrophilic. Ask whether you are on the lowest effective dose. Ask if your cognitive health has been part of that calculation. Think of someone right now, a neighbor, a close friend, someone in your family who has been saying their memory is not what it used to be, that they feel foggy. Send them this video. That one share may be the most genuinely useful thing you do today for someone you care about. The 6th medication carries a risk that almost never comes up at the pharmacy counter. Muscle relaxants, particularly cyclobenzaprine and carisoprodol, are commonly prescribed for back pain and muscle spasms. Most patients assume these only affect the muscles, but they cross the blood-brain barrier and carry significant anticholinergic activity. The American Geriatric Society places cyclobenzaprine on the Beers criteria, a list of medications potentially inappropriate for adults over 65, specifically because of cognitive risk. If you have been prescribed a muscle relaxant for chronic pain, ask your doctor whether physical therapy or a different pain approach might be viable for your situation. The 7th medication is the most commonly overlooked. Statin medications, atorvastatin, simvastatin, rosuvastatin, sold as Lipitor, Zocor, and Crestor, are taken by tens of millions of Americans over 60. Memory problems, brain fog, word retrieval difficulties, these are documented side effects acknowledged by the FDA, which updated statin labeling in 2012 to include cognitive impairment. The brain uses cholesterol to maintain the myelin sheath-coating nerve cells. Think of that sheath like the rubber coating on an electrical wire. When the coating thins, signals arrive wrong or late. That is what some patients experience as brain fog. Statins are life-saving for many people with cardiovascular risk. But if you started one in the past 1 to 3 years and noticed cognitive changes since then, tell your doctor exactly this. I have noticed cognitive changes since starting this medication. That phrase opens a very different conversation. I want to be honest with you. As a doctor, I have sat with families in waiting rooms at dawn. I have explained to adult children why their parent, who seemed fine a year ago, can no longer recall their grandchildren's names. And in case after case, when I went through the full history, I could see the moment the trajectory changed. Not a stroke, not a tumor, a medication review that never happened. A question nobody thought to ask. The brain after 60 is more sensitive to chemical interference than it was at 40. The medications running through it every day deserve more scrutiny than most people ever give them. You are giving them that scrutiny right now, and that matters more than you may realize. Let me bring it together. The 7 medications we covered are antihistamines containing diphenhydramine, anticholinergic bladder drugs, long-term benzodiazepines, proton pump inhibitors, lipophilic beta blockers, muscle relaxants including cyclobenzaprine, and statins, in patients experiencing cognitive changes. For each one, the conversation with your doctor follows the same structure. I have been on this medication for this long. I read that it can affect memory in adults over 60. I would like to review whether it is still the right medication and dose. That is the entire script. The patients who caught these effects early, who had that conversation before damage accumulated, they kept their clarity. The only difference between them and those who did not was information. You now have it. If this video gave you something worth acting on, share it. Think right now about the person in your life who is over 60 and has been on one of these medications for years. A spouse, a parent, a sibling, a close friend. Send this to them today. That one tap may be the most genuinely important thing you do for someone you love this week. Tell me in the comments which of these 7 medications you or someone you love is currently taking. I read every single comment, every one. Your comment may help someone else in this community ask the right question at exactly the right time. Next week, I am going to show you 5 early warning signs that your brain is already under stress right now, signs most people dismiss as normal aging, that are actually the first measurable signals of cognitive decline. Specific signs, specific timelines, and specific daily habits backed by research from Harvard Medical School and the NIH that can slow or stop that process before it goes further. Hit subscribe and turn on the bell, because if today was useful, next week is going to matter even more. Before I go, everything I shared today is general medical information based on published research and more than 2 decades of clinical experience. It does not replace your personal medical care. Before making any changes to your medications, especially stopping or reducing anything, please speak directly with your own doctor. They know your complete history, they know your body, and that converse